Good morning, everyone. We have Nurse Kitty's dog Tilly here, and she's having acupuncture today. Kitty, do you want to tell us a bit about Tilly?
So, Tilly is almost 12 years old. She is a girl. She's a Labrador. Tilly has recently been diagnosed with cancer. She had a mast cell tumour that we removed from her side here, which is why she's flatteringly giving you her what. She had mast cell tumour removed from here. She started chemotherapy yesterday. And so we're going to do some acupuncture with her because she does get a little bit of stiffness and joint pain and arthritis in her age. Yep. She looks like a young sprightly thing.
Then how old is she?
She's almost 12.
Oh, it's alright, sorry. Nurse Charlotte was about to join us for our Facebook Live.
She's gone away.
She's eating.
Let's go, bye. So Tilly's 12 years old almost. We're doing some acupuncture to help with her mobility and also probably some cancer curing points. Yeah, helping points.
Well, what we'll do is we'll probably put, when we do acupuncture, a lot of people ask us how on earth do we do acupuncture on weight animals. Bribery and corruption is how. So she's got her special everlasting tree ball that she's got here that she loves. There are two types of acupuncture points that I use. I use local points, which might be points around the problem. So now Tilly gets sore hips, does she? Yeah. So I'll be putting hip and local back points in. And then we have what we call distal points. So we have points that are further away that will have a positive effect on how she feels as well. So she might end up with some points further down her legs. I'll put a couple of points in for nausea as well because she's having chemotherapy. One of the side effects can be gastrointestinal side effects. So sometimes they might feel a little bit nauseous or go off their food or have a little bit of an upset tummy. So I'll put some points in that is just for really good for nausea as well. And I'll put in some general well-being sort of immune stimulation kind of points that just help her body to be as strong as it can be. She's a little bit noisy. Less hair. So Tilly's had acupuncture a few times with us. And so what I do is I use these tiny little acupuncture needles. So they're much finer than needles that we use to give injections with. And she'll end up with 20 acupuncture needles in. Okay? So I'll just get them all ready first. Is she allowed other snacks or does she?
She's allowed other snacks. I'm just out of reach.
I'll get them for you.
Sorry.
I might do this so you can. So some of the acupuncture needles will fall out. That's totally fine. Even if they go in and come straight out, they will have done something, okay? What we know about acupuncture points is that they've done some studies on acupuncture points. They've done histology. So what they've done is they've biopsied the acupuncture points and looked at them under a microscope, and they found that there's more inflammatory mediator cells down at acupuncture points. We don't fully understand how acupuncture works, but it does do things like get the body to release endorphins, release cortisol, and it really taps into the body's innate ability to heal itself. So from a Chinese medicine perspective, acupuncture is often about restoring balance to the body. Okay. So you'll notice she barely notices these needles going in. Now I've said that, she better not. Could you imagine? Be typical. So this is GB20 that I've just put in her head. It's a calming point. I also like to call it the unicorn point because it makes them look like a unicorn. And so acupuncture points are based on anatomical landmarks. So basically what I'm doing is I'm feeling for different parts of her anatomy, and then I will feel for that, and you can see she's a little tender there. I'll feel for it, and that tells me where I need to put my acupuncture point, my acupuncture needle in.
That's good patient, Tilly. You're doing so good.
So great. She's like, I'm the best.
She's like, I'm a good girl. As long as I have snacks, I'm happy.
Hashtag Labrador life.
Exactly. Okay.
Alright. So So this one can be a little bit ouchy, but it's really good pain relief point. Oh,
Yeah.
She said, oh my goodness.
Good girl.
This is large intestine 4, so it's here on you. They use it in people for migraines and headaches. Don't use it if you're pregnant. It is forbidden in pregnancy. You can also use it to induce labour. So let's not practice that one in people. There we go, perfect. You're just the bravest. I'm going to do GB14 here. This is a really good point for stimulating her immune system. Okay, so we want to do that for her. Alright, do you think she'll stand up so I can pop some in the back legs?
Oh, I don't know, she's a bit floppy. Come on, let's go. Come on, pop up. Good girl.
Good girl.
I got you.
Good girl. That's the way.
Good girl. Good girl today.
So she can lay back down once the needles have gone in. Thank you.
Oh, you said that
That
one.
one was ouchie.
So that's my poor you, Belinda.
I was like, that's an ouchie.
Oh,
we got ouchie lips. Come here.
I know, you're like
Sorry, we're eating a little bit quickly. Okay. Good girl. Good girl. I know. Wait a minute. Yes, Tilly likes to spend her life laying down. She doesn't much like standing up. I've got to give her a little bit of support here.
Good girl.
That's a nice lady.
You're so brave, darling. You're so brave.
No. Oh, good girl. Good little unicorn lady.
I know. So cute.
Oh, is that ouchie? Is that in your butt? Hey, sorry. Where are you going? Oh, we've thrown it in.
Your unicorn,
Oh,
your unicorn point fell out.
It's okay, you're still magic to me.
there we go. Alright. Perfect. Now she can sit down. Okay, so now that all the needles are in, it's fine if she has a lay down. If she sits on the needle, it might bend, but it's not going to snap off, and it might fall out. So the needles stay in for 20 minutes before we take them out. But you can see that it's not terribly stressful for them having acupuncture.
She's like a high stress dog.
Yeah, it's just normal. But we'll just see. She'll probably sit down shortly and we'll go from there.
Hi.
We might need to give her.
Till.
Come on, come here on the bed. You want to sit down?
That's the way.
That's
That's
nice
good.
lady. That's so hard. What do you reckon? She's like, I'm not going to lay down for you.
She goes, no, I will not perform.
I will not. I'll do a good bit. You just want snacks.
I know. Yeah. Anything else? Acupuncture is we normally do it once a week for 3 to 4 weeks when we first start treatments. And then the aim is that we start spreading treatments out with the aim of doing it only 3 or 4 times a year. The most common reason that I would treat a patient with acupuncture would be because of arthritis or sore hips, sore back, sore knees, sore necks. They're the sorts of things I tend to treat the most, but I can treat other conditions with acupuncture as well. So some of the stranger things I've treated facial paralysis in a dog, so one half their face stopped working, and so I treated that. I've treated another dog for dry eye. That's tricky because treating them for dry eye, you need to put local points around the eye, so not every dog is going to sit still for me to stick needles in and around their eye. What else? I've definitely treated cancer patients for nausea before as well. We're treating Miss Myla this afternoon. She's got spinal paralysis, so she's post-surgery. She hasn't walked yet. And we're just trying to help her. Her parents are so dedicated. They're doing everything for her. She's doing acupuncture, hydrotherapy at SASH, laser at SASH, seeing the physio at SASH. She had spinal surgery at RH. They are incredible. They're doing everything for her. Even so, they took her for a bushwalk on the weekend.
Yeah. Did you see that?
I had no idea that I have to see it.
Yeah, she's in a little harness, and then she's got another harness that helps her walk in her back legs. So they'll carry her most of the way, and then let her still have a sniff and a walk around. Which is so lovely because she's only a young dog, so she still needs that mental stimulation of getting out and about.
Yeah.
Okay. All right. Well, if there's no questions about acupuncture, then I will let Tilly get back to just eating her body weight in treats.
It's okay. We get home, we're back on that diet life.
Exactly. The diet starts tomorrow.
Yeah.
Yep. Certainly for her brother Nico.